Hi, thank you for taking the time to watch this webinar about the recruitment for Cohort 4 of the Topol Digital Fellowship. My name's Louise and I'm a Programme Manager in the NHS Digital Academy, and I'm responsible for the delivery of the Topol Fellowship. So just to give you a bit of an overview about what the Topol Fellowship is, it's a 12-month fellowship for health and care professionals and colleagues, which gives you the time and support and training to lead in a digital transformation or innovation project within your own organisation. So the programme provides you with the time to actually focus and look at a digital health improvement and transformation project within your own organisation. It gives you a series of workshops and sessions which give you knowledge and skills which will help support the project, and will give you access to a facilitated community of peers who will support you throughout the programme. There's support, expertise and light touch coaching all the way through the programme available to you from both the programme team and the programme delivery partner. And there's support through the Topol Digital Fellowship alumni and the Digital Academy alumni. So what does it actually look like? Well, the core of the programme is your project. So all of the learning that you have will be around your project and how you actually take that through to successful delivery, or wherever that delivery point may be, because we do recognise that in a 12-month programme, it isn't always practical to take something all the way through from scoping to looking at a problem all the way through to delivery at the final stage of a project. So what we do is we give you a series of workshops that explore agile methodologies, and a series of lunch and learn sessions that will help you to support your design thinking and what that looks like. There's also an online course in machine learning and service delivery and design, and there's a facilitated online community where you'll be able to communicate with your peers on the programme. There's also access to the alumni masterclass series, and I'll talk about a little bit more of all these things and what they actually look like. But first of all, I just wanted to talk about the benefits and impacts of the programme from research that we've done from cohorts to date. So up until this point, all of our cohorts have just been made up of healthcare colleagues, but going forward, it will include social care colleagues. But what we've found is the benefits and the impacts, they are transferable across sectors, and they will be applicable to your organisation, no matter where you work. So what we've seen so far is that there's 6 key areas where where Topol Fellows are having impact and they're seeing the benefits of their projects. So these are around data management, diagnostics, saving time for you as an individual or a profession in your role, saving resource or money, improved practices, and these are things that will be applicable across different sectors, and better patient outcomes, which is ultimately where we want to be. We've also seen benefits in terms of people actually using the learning from the workshops and the lunch and learns in their own organisations and applying that learning in their setting, which is what we want. So what is Cohort 4 and what does it look like? So there'll be a face-to-face launch and then a closing conference at the end. There'll be a core programme, and these are 6 workshops based on agile methodologies and 4 lunch and learn sessions. There's also a machine learning program which is made up of 4 workshops, and these primarily focus on the socio-economic barriers and benefits to machine learning and AI and how you can use it and apply it in your setting. There's also an introduction to machine learning in health data science. There's a session as well at the end with a panel from people across the sector who are using machine learning and AI within their day jobs and doing research around that. The masterclasses change year by year, but these are just some examples of the sessions that we've had this year. So we've looked at information and governance, we've looked at practical application of human-centered design and user design, and we've got a really good masterclass coming up on collaboration and innovation in the NHS. All of these will be applicable to both health and social care colleagues. So what does the support look like on this programme? There's programme team support from us. So we are the Digital Academy and we're here to support you throughout your programme. There's support from our programme delivery partner, whoever that will be, and that'll be through one-to-one coaching or group coaching sessions. There's also specific mentoring and coaching relating to your area, and depending on where you're working, you may get some enhanced support within that area. So if you are from a social care background, you'll get some mentoring and coaching support from within the social care sector. There's also peer support. So we've got the online facilitated community, so you will support each other. And to be honest, most of the support that people get on Topol is from their peers and from their fellows on the programme. There's loads of networking opportunities with alumni and current fellows, so we will be getting you all in a room and setting you up for those collaborative working relationships. And there is an annual Digital Academy networking event that you'll be invited to attend. So what are we offering in Cohort 4? So there'll be up to 50 places in total, including up to 2 sponsored places with the British Association of Dermatologists. As part of your offer, you will be offered up to a bursary of up to £15,000, and this is paid to your employer to be used how you and they wish for the successful delivery of your project. You'll receive the programme as described and the support that I've talked about earlier. In accepting this offer of the bursary and the programme, we have there are some things that your employer must also commit to, and the main part of this is that they are protecting your time between 0.2 and 0.4 whole time equivalent of your day job, and this is so that you can really focus on the deliverables of the fellowship and your project. They need to ensure that this bursary is ring-fenced and used to support the fellow, to carry out their project. And they need to ensure that you have a named project sponsor who can champion you and support you through the fellowship within your organisation. And this person should be somebody that can open doors for you, make introductions, and support you if you're having any challenges in the delivery of your project. Essentially, they need to be able to enable you to attend, enable you to actually engage, and for you to deliver the project that you're working on. So what is the eligibility criteria? So it's really exciting. This year is the first year that Topol is going to be open to all staff, clinical or non-clinical, working in or delivering services to the NHS or social care in England. If you're clinical, you need to be registered, and if you're medical, you need to be post FY2. And all applicants must be working in a role where you're able to focus on a project and have your time protected for 0.2 to 0.4 whole time equivalent to be able to deliver that project and engage with the programme. We're also welcoming applications for sponsorship from the BAD, and the eligibility criteria here is exactly the same, apart from you obviously need to be a member of the BAD, but also the criteria for working in or delivering services to England, that's across the whole of the UK with it being a national body. Other than that, the criteria is exactly the same. So what are the timescales? Applications are now open. They opened on the 1st of November and they will close at just before midnight on the 1st of December. You'll hear about shortlisting outcomes by the 23rd of December, and interviews will be week commencing the 16th of January. Full details of the interviews will be sent to you with the outcome of the shortlisting. So I just wanted to take a moment just to think about the actual application form. So there'll be 4 key things that we ask you about in the application form, and these will be blindly marked by a wide group of shortlisters, and they won't have any information about who you are, where you work, what you do, where you're from. These are the 4 questions that we'll really be focusing on when we're shortlisting, and we're asking you about your prior experiences, your professional aspirations, the problem that you'd like to explore, and the support that you can access within your organisation. And just a thought about professional aspirations. We don't expect everybody who's applying to this fellowship to know exactly where they want to be or be on a career path that's linear. What we want to hear, though, is about what you would really like to get out of the future and out of this programme and how you think it could support you. It really doesn't matter if you don't have a clear pathway defined. This is about building your own pathway and making a future for yourself within this area of work. What are we really looking for in these applications? So we want to see enthusiasm, and we want to see people who champion digital change. We really want to see a genuine curiosity about the problem that you've got and how you might be able to address it. And we want to see that argument about where this fellowship fits with your career and what you'd like to do in the future, or what you think you might want to do in the future. And we really want some good ideas about how you will be supported locally and how that might be organised and what your project might look like on the ground. So thank you. If you've got any questions, please do email. Also, please have a look on the website. There's lots of information. You can either click on the link or scan the QR code, which will take you straight to the website page. There's lots of information on there. There's also links to the webinars that you can sign up to if you're watching this on the website. And I'm looking forward to seeing your application soon. Thank you.